what COVID-19 brought out was that to build trust, you have to be proactive because of all that was going on around. And because it was sort of a unique situation, once the initial bit went over, we sort of lapsed back into wherever we came from. And then there's this vacuum that then gets occupied by misinformation and so on. Corruption is a big topic. I can tell you, for me, part of what I learned and what I do personally is that I work with a number of journalists. So I've kept a little network so that we're able to, they can call me up as a professional. I don't have to have my name in the forefront, but at least they will fact check before publishing. So that has continued in the health space. That's just a personal thing that I do because then I got those contacts and can be able to get an article here and there, and even in terms of social media. So we keep that going. The other bits, because politicians are overbearing in our space, it's very hard to contradict. So I think it needs work when we're talking about the health system. So part of what Busi presented in terms of leadership from the business community and everyone else as well, it needs to be there. I think we've had some other discussions even about health professionals who are working within the public sector, that you can't keep quiet, but at the same time, you don't want your head to be the one that gets hammered. So there needs to be some collective safe spaces where people can give out their positions. So kind of like what we're talking about, the ethical hotline. So within the health system space, there are a few. I know within the HIV community, in terms of providers, they do have some forums where people can ask questions and so on, and just check on what is going on. But there's not enough of it going around.